Hauer. I've been practicing at Orthopedic Associates for about a year now. I finished my medical degree at UNM and did all my orthopedic surgical residency down there. I did a fellowship in sports medicine at the Campbell Clinic at University of Tennessee in Memphis, and moved out to Farmington, where we've been welcomed by everyone in the community. The practice is a great practice with a good group of doctors that are supportive. The patients are fantastic. You get to know them. And that's been the best part over a year, is getting to know people, getting to see their progress, seeing them out in the community doing well, seeing them at Connie Mack games.
I was walking down the hall and we had a plastic runner on it, and as I got to the end I slipped on it and fell this way, face first.
So it's a lot of fun to see patients and tell them what's going on with their injury, whether it's a knee or a shoulder, because patients don't always know, and so they look to you for information. So being able to teach them a little bit, being able to guide them along the journey, tell them what their options are, and then if they actually need surgery, helping them out with surgery and then their recovery process. And a big part of that's reassuring them that they're going to get better, that they're doing well, and there's some hurdles that I've taken people through, but they're going to have to go through those as an individual. Joint replacement, whether shoulder or knee surgery, is always a big reward, because you take people that have a worn out joint, can't use it much, and then you see them get function back in that, be able to use that, and that's great. They're some of the happiest patients you treat. Taking care of young patients or any age of patient that is having a lot of pain, and you fix their ACL or their rotator cuff, and to see them get back to the activities they want to do and be happy is really rewarding. It's nice that we have almost everything in-house we can get. We have excellent x-ray techs, excellent MRI, getting all that in-house so that patients can get their workup, their treatment, their diagnosis, all set in one place, I think is convenient for the patients, and I think the patients like that. So I think when we get the new MRI, that'll be a great addition to the practice. It'll give us expanded capability in some of the best images so that we can make that diagnosis and interpret disease issues and help the patients figure out what's going on a little bit better. So I think one of the first things is to figure out what the patient wants and what they're here for, and then getting to know them a little bit as to who they are and what they do, because I don't think you can really make good treatment recommendations without understanding their goals, what activities they're hoping to return to, and then really listening to the patients as to how this is affecting them. They don't know exactly what the options are, and so they're really looking for somebody that can make a recommendation with their best interests in mind. And I think understanding the patient as much as I can is the best way to do that. The best advice for somebody who has a specific injury or pain that they're not sure what's causing it is to come see us, because we're the specialists in bone and joint, muscle and tendon conditions throughout the body. And so we'll work it up, we'll get great images to help diagnose you, we'll figure out what's going on, and then we're going to be the go-to doctors in treating you, making recommendations, and best of all, we're here local, and I think every doctor in the practice is absolutely excellent. So you'll hear, so I think making an awesome surgeon, a lot of people will say they don't care if their surgeon has good bedside manner, they just want them to be technically outstanding. And I think that's a component to be really good in the operating room. But I think getting to the operating room and deciding who needs surgery and when they need surgery, being a compassionate listener, is as much a part of being a good surgeon as being good in the operating room. So in my spare time, my wife and I love to do outdoor activities with our 3 kids. You can find me up in the mountains on the snow almost every available weekend in the winter, whether it's snowshoeing, skiing. In the summer, I love to ride my mountain bike, go running, take our boys camping, and kind of share our outdoor passion with them.